Joining us now, the president and CEO of the Mississippi Hospital Association, Mr. Tim Moore. Tim, good to see you. Thanks for coming in.
Well, good morning, sir. Good to be here.
Yes, sir. I first just want to tell you that I really appreciate you inviting me to come down and speak to your group, your organization, earlier this month.
You did a great job.
Well, thank you,
Had
Tim.
a lot of very positive comments, and we appreciate you doing that.
Well, I appreciate that. A lot of smart people in attendance that are trying to work through something we all got to have. That's health care. It's complicated. There are no easy singular solutions to the many problems that are on the table for the industry, but you guys work through it. And so it's good to see a lot of smart people get together for a kind of a common goal like that.
Absolutely. Been doing it for 90 years.
90 years.
90
That's
years.
Unbelievable, isn't it?
It's pretty impressive.
All right, so give us an update. What's the status? I mean, the last time you and I talked, and I think what's been front and center, certainly in the state of Mississippi, or many of our hospitals are experiencing very difficult financial times, and they're trying to make ends meet. What's the status now?
You know, it's still we're still facing the challenges that we were. Actually, I'm on the road last week and this week visiting hospitals and hearing some of the same things. I am excited to hear that in some of our staffing issues, at least in some of our smaller hospitals, is improving. Some of our folks that left and went off on contract assignments have come back and are I think glad to be home and back with their communities. So those are positive things. The other side, of course, we all know that COVID created an increase in wages that will never go away.
Yeah,
that's there. So they're still having to wrestle with how they do that, how they meet those demands, and of course, just expenses in general have not come down, just as they have not for us. I mean, supplies, drugs, anything that a hospital has to pay for, the cost has gone up exponentially, and they're still trying to figure out how do they balance that. Interestingly, I had run across an article earlier that kind of gets into some of what we're talking about here and kind of looking at what's going to possibly develop as we go forward. And the fact that patient acuity is on the rise and is projected to continue to rise through 2033, that's not really good news for our hospitals, because what we're seeing...
What does that mean exactly?
Well, if you look at... let me tell you where I got it. Vizia is a GPO that a group purchasing organization. They partner with other folks. SG2 is a part of that does analytics and projections going forward. And what they are seeing that over since 2019 to currently, the case mix index is up 5%. Now, the case mix index determines the severity of a patient.
Okay. How
sick you are, what complications you have. What the diagnosis is, or multiple diagnoses, affects that case mix index. So you've got a sicker patient we see already, and that will continue to rise. And what's even more disturbing is that the length of stay, which is the time you're admitted to the hospital, the time you're discharged, the midnights, is increased by 10%.
Okay.
So all of that is in the direct opposite of what we're hoping to see happen. Now, SG2 is also predicting there'll be a 2% increase in the number of inpatients admissions over this period of time, same period of time. So that is not necessarily a frightening thing, because admissions are down so low in comparison to where they were prior to COVID. There's no indication that they'll ever get back to where they were. But we're looking at a situation for hospitals where you have a sicker patient that takes more resources, more personnel to treat a complicated patient. So the complexity of the patients we see is going to increase. It makes sense, because what we're doing is we're pulling out the healthier patients, or the less sick patients. Let's say that. There are no healthy patients go to the hospital anymore, but the less sick patients are coming out, so it's changing that ratio. So what you have in the hospital...
And let me interrupt you there, Tim.
Sure.
So by coming out, are you talking about this sort of a proliferation of ambulatory services,
Absolutely.
for example, where
Absolutely.
you just go in, whereas you used to go to the hospital, maybe you were there for 2 days for a procedure now that you could do at an ambulatory-style clinic, and you're there in less than a day, in and out, same
absolutely.
day, right?
Needs.
No inpatient, no
absolutely.
overnight.
No overnight. You're home.
Which is a more profitable service, right? From a healthcare perspective.
It could be.
Than the long-term inpatient.
And it should be a less expensive service.
Right. Consume fewer resources.
So what that kind of gets to is how do we restructure this animal that we've created over time? Because, as you know, it's like turning a battleship.
Yeah.
It takes time to do it because it is so large, and the complexities and how it all works are just
and you've got facilities and organizational structures and processes and systems that are all built around the combination of the inpatient and the ambulatory.
Correct.
And if a piece of your business starts to shrink and you got sort of assets you got to now reallocate. I mean,
you're spot on.
Okay.
You know, I was just reading where Walgreens is having difficulty getting their healthcare projects off the ground. However, CVS continues to put money into theirs and grows it. And certainly I'm not being negative towards CVS.
Sure.
But that will be a different model in the amount of acuity
I got you.
in the patient that they treat.
I got
now,
you.
I do understand that they are working on some methodology to look at more chronic management in those patients. That really gets on the healthcare hospital side of the fence. But, I think we as hospitals have got to adapt to the new model and determine exactly how we're going to compete against the disruptors that are coming into the market. Now, we still, regardless of what we do, we're still in a situation where we have to be able to provide inpatient care because our bodies wear out.
Sure.
It gets to the point that the ambulatory treatment just won't get it.
Yeah.
So you've got to figure out, okay, how do we make this transition, but yet how do we shrink this inpatient model and move forward?
Yeah,
and that's kind of where we are there.
Okay.
Interesting. Some of the other things is looking at the decrease, a 13% decrease in retail or urgent care settings. I thought that was very interesting. Now, I think that's probably got to do with a lot of the
decrease. And I'm seeing them spring up with my own eyes.
Absolutely, and that's what. But by 2013, you're looking. Their projection is a decrease.
Wow.
Outpatient surgery is up 18%.
Got it. Yeah, that makes sense. Yeah,
that's that volume coming out of the hospital.
See that here locally.
Absolutely, you see it. And then a huge increase on the home care side. 20% increase in home care. It's a less expensive model because that's going to take patients from your skilled nursing facilities and bring them home and take care of them at home where it's less expensive.
Yep.
So, some interesting dynamics coming forward. And that kind of gets on to one of the things that we talked a little bit about, and that's the CEO turnover.
Yeah.
And the concern of what's going on with CEOs and the changes that we see.
Well, all right, so something else that just to throw into that complicated, convoluted set of dynamics there, you've got United Healthcare. I've been watching this. All right, so United Healthcare, if I'm not mistaken, Tim, the largest insurer in the country. Is that right?
I think so.
I think they write more policies than any other.
I think they've got the high stock price, too.
They do. And, and I think it may be because they seem to be pursuing a strategy of vertical integration.
Yes.
So they recently bought home health care provider, Amedisys.
Yes.
Baton Rouge-based company.
That's right.
Full disclosure, one of my biggest customers was Amedisys.
Okay.
And that goes back to 07, 08.
Sure.
When, I can't remember the gentleman's name, was a nurse that had this idea, that founded this company.
Started it,
became a public company.
Yep.
You know what I'm talking about, though. And they just sold it for $3.3 billion.
He did well.
Public company, did well, $101 a share, to United Healthcare. Now, they also just bought LHC Home Health Care. I think they paid $5 billion for that. So it sounds to me like this big insurer.
I was actually with an entity that sold to LHC.
Oh, okay. Okay. So, $5.4 billion. So United Healthcare, an insurer, appears to be really spending a lot of money getting into the healthcare delivery business.
Absolutely. Well, look at 20% increase in home care visits by 2033.
And that's what they see, which is why they were willing to pay a premium, probably, for LHC and Amedisys.
Well,
so they may be the largest. I don't know. It seems like it to me.
We started out with what? Just go back, Blue Cross and Blue Shield. It was owned by hospitals and physicians.
Right. That's right.
And we got out of it.
Right.
Boy,
exactly.
did we mess up, didn't we? We wasn't very smart, were we?
Exactly. But this vertical integration theme seems to be taking hold in healthcare.
No question about it.
Let's continue the discussion. You can hang around.
I will.
We'll continue the discussion with Tim Moore, President and CEO of Mississippi Hospital Association. Stay with us. CEO, we thank you so much for joining us. It's Tim Moore, President and CEO of the Mississippi Hospital Association. Tim was just giving us kind of a rundown of the state of the hospital industry in the state. So this vertical integration thing, which has occurred in other industries, I guess I just sort of woke up and said, gee, this is weird. A big insurer like United Healthcare buying healthcare delivery organizations, in this case, home health care.
Home health.
And I guess they see the prospect of that in the future.
Absolutely. And of course, we've seen it in other states across the country on ambulatory surgery centers, clinics, freestanding facilities. Matter of fact, actually, United may have been the company that actually invested in freestanding ERs. But they definitely have moved into that space.
And those sorts of organizations, some have fared pretty well, some have failed. The ER, third-party ER operators, right?
Absolutely. Absolutely. If you look just historically where the freestanding EDs were set up, they were in high commercial neighborhoods. And when I say that, I mean they were in neighborhoods that the population was very well insured. And
privately insured.
Privately insured.
Yep. And
paid very high rates.
Yep.
So, that has not worked in Mississippi. We've not had anybody that's jumped on board with that. You only have 2 or 3 regions, well, even regions in the state it would work.
Yeah.
You don't have anybody running the Mississippi Delta and putting up a freestanding ER.
No.
It just won't work. So those are challenges that we've got to figure out how do we get through.
Yeah. Well, all right. So then we had a couple other things going on there. You and I were just talking about a recent report that ranked Mississippi worst in the nation in healthcare performance, in the bottom 10 in a couple of dozen metrics. And is this what do you attribute that to? Is this, Tim? Is this a function of poor quality care being delivered by the industry, or is it just we have a sick population? Because a lot of that's what they look at, the outcomes.
Absolutely, it's the outcome side. And yes, we do. A lot of the issue, matter of fact, in that report, and of course it was the Commonwealth Fund, which was a nonpartisan research on it. One of the VPs was quoted as saying that, the first thing you could do in the non-expansion states would be expand Medicaid. Yeah. That would be the first thing that would move the needle on a lot of these things. We have a population that if you look at 200% of the poverty level.
Right.
Okay. And that's $55,000, $60,000 a year for a family of 4.
For a family of 4.
Something like that.
200% is.
200%.
Yeah.
So if you look at that population in the state of Mississippi, 30% of those are without any kind of health care coverage. That leads to part of our problem. Certainly we've addressed some of the maternity issues, the postpartum care. Yeah. That's going to help in some of those measurements. And other things that we were high in vaccination rates. We were doing the right things. Yeah. Cost, we're good. And that is part of our problem. Our cost is so low, but our reimbursement is even lower. And it creates the problem of being able to do those extra things that we need to do to try to improve some of these outcomes. So, but no, I think you've got, in some cases, it's an education issue in order to get to compliance. If you're going to take care of a patient, they have to be compliant. I was in a meeting a couple of weeks ago with counterparts across the country, and one of the things that we kept coming back to is the healthcare system is broken. Hospitals will be the first one to admit that. But we cannot put all of this on the backs of the hospitals to fix. There's just no way. There's too many variables. You have to come back with the insurers, the employers, the government, both state and federal, and the hospitals, and sit down and say, okay, guys, this is what we want to provide. Now, how do we do that? Because it's got to be financially sustainable, both being paid and then also being able to pay your bills and make it a viable operation.
I totally agree, and I've thought for some time that to address these issues, you need a wide range of experts that come from all the major disciplines that are involved in this, because healthcare is one of those industries where there are legal issues, obviously, there are public policy issues, there are economic issues, there are clinical issues, there are ethical issues. as well.
No question. And that's one of the things that we worry about. If you move in a direction to siphon off the profitable business in whatever entity, then you start questioning, okay, is the quality there, or are you going to take care of those patients regardless, or is it just from a profit motive?
Yeah.
And that's one of the things that always concerns us when we start talking about healthcare, because you've got to take care of the patient, and you got to take care of all the patient.
You don't have the latitude to say fire a customer. You can't tell the patient, I'm sorry, you can't pay, or you're too sick, you're costing me too much, get out of here, because I think most of us that have been in the business decision-making world, as I have, you've every now and then come up across a situation where you say, you're just not worth it anymore. We're going to have to let you go.
Make a decision. That's right.
Yeah.
Now, I will say that, and I have seen situations, particularly in medical offices, when you have a patient that is just completely non-compliant, will not do anything you ask them to do that's trying to help them. And I have seen patients discharge those patients.
I'll be darned. Well, I got to tell you, I hear this complaint regularly from my physician friends in my circles, socially. Sure. They won't talk about that publicly, but privately they say, it's crazy. They keep coming in and they won't do. And when they even confront them with it, well, are you doing this? You doing that? You taking this meth? Oh, no, but you're going to still take care of me, right? Like, you're not getting this. You're not,
I can't take care of you if you don't do what I ask you to do.
I hear that a lot.
Gerard, part of that, though, in some of those patients is the fact that they don't have the discretionary income to go buy their medications or to do follow-up or to do what they've been asked to do. Now, that's not all of them.
Yeah.
Don't think that's all of them. It's not.
That's right. I agree.
We've got family members probably that say, well, I know what the doc told me, but I really think it'll be better to do this.
I think I may have shared with you before. I was in a physician's office. It was a specialty, and she shared with me she had just seen a child, and was frustrated because she knew the parent of this child was not going to purchase the prescribed medication for the child. Right. And what the physician said, but she's got her $300 Dooney and Burke purse or something to that effect, and drove here in an expensive vehicle, but won't go spend the $50 to go buy the drugs that she just prescribed for the child. That happens too.
It does.
As well as people who just don't have the available money.
That's right.
To buy whatever it is they need. Sometimes it's therapy. Sometimes it's pharmaceuticals. It runs the. Sometimes it's just, you're instructed by the physician to adopt certain lifestyle changes, and you just don't do it and wonder why you're still sick.
That's exactly right.
And that costs us all. That's the point. No, we're all paying for it.
That's exactly right. I agree with that 100%. Something just hit me, too. We was talking about those statistics and going through to 2033. It kind of goes on the same thing, why we all need to be mindful of our health. The three most rapidly growing issues or diagnoses were behavioral health issues, neuroscience, neurological issues like strokes and things like that, and cardiac. Those three things. And there are ways to prevent all of those, at least to some degree. Now, there are chronic problems that you just have to deal with. But most of us, if we would seek early care and follow that and listen to our physicians or our providers, then we could offset a lot of that, and that saves us all money.
And we don't fare well in Mississippi in those three categories.
We do not. We're at the top of the list on all of those, too.
Yeah. It's sad. So we've had some CEO resignations as well, a couple of major hospitals. What's going on there?
It's the market. I was looking back, too, and trying to pull some things together. If you look at all CEOs, all American companies, let's start there so we get a baseline.
Okay.
If you look at the first 5 months of 23 compared to 22, it's up 54%.
What's up exactly?
The turnover.
Okay, gotcha.
The loss of those CEOs up. Which is considerable. If you look at that,
yes, it is.
I mean, you start wondering, okay, now what's going on?
Yeah.
Well, that's everybody. That's the big companies. That's out there. Now, if we go back to hospitals now and you look, our turnover rate, at least in Mississippi, is on track to be greater this year than it has been in the past.
Yep.
Now, if you look at 21, 20, and 19, it was 16%, 16%, and 17%. Year to date, we're approximating the turnover at about 11% for the first 6 months.
Okay.
So, you got retirements. you've got all those challenges that you and I just talked about for the last few minutes that are creating a much, much more difficult
family
situation.
issues, stuff like that. Yeah.
So if I'm getting close to retirement, then I'm thinking at it and I'm looking at it a lot harder.
I got you.
I had a friend of mine tell me, he said, well, just look at the numbers. It might work. So,
I get you. Tim, appreciate you coming in, man.